Assalamu alaikum. I hope so. All you guys are fine. So today, as you all guys know, that's Iqbal Day, and today I have arranged a small virtual conference basically on Iqbal Day, and we have basically a series of lecture. So today I am here with Dr. Naghman Zuberi. Assalamu alaikum, sir. How are you?
Walaikum assalam. Alhamdulillah, I'm good. And it is a very big honor that today we are presenting this on the day of birthday of the great poet of all the times, Dr. Sir Allama Iqbal. So let's start with one of his verses that तुम दिए बाद मुखालिफ से न घबराए उकाब ये तो चलती है तुझे ऊंचा उड़ाने के लिए. So anyone who is having any difficulties in the life, well, these are part of the life, and definitely if you will try to overcome those difficulties, so one day you will achieve that glory which you are actually destined for, and which you are looking forward to achieve that glory. So inshallah you will achieve that. My all the prayers to all my viewers and all the students, inshallah, that one day you will be a very successful academician as well as a very successful clinician, inshallah.
Inshallah. Thank you, sir. Sir, you can share your screen.
Okay, is it good? No,
Yes.
sorry. No.
No,
This
it's
is
okay.
not the one. Share screen, application window, and here it is. Okay, so we are here.
Yes, sir. You can start.
Good. Okay, guys. So today, actually, why I selected this topic of extraction or non-extraction. We were receiving a lot many queries that for orthodontic cases, is it always necessary to extract the first premolars in both the arches or not, or only the upper two premolars should go, and whatever and what not? Well, first of all, as I told you, the question which we were receiving, is it necessary in every single orthodontic case to extract teeth? Yes, no, maybe. My answer is maybe. And that big answer is depending upon certain situations. It is not necessary that every time you are going to have a case and you have to firstly extract the teeth without analyzing their profile, without analyzing what is going to be the final achievement, what would be your final destination, how the aesthetics are going to be changed. There are many factors which dictate us whether we have to extract or we should not extract. Depending upon the type of malocclusion, then the amount of crowding present, and a big question is of stability. Post-treatment stability is also a very serious and major concern. Are we going to make our case stable without extraction, or it is necessary for us to extract the teeth, align the teeth for the future stability, and it's not going to be relapsed? There are certain borderline cases where some of the experienced clinicians, they will say that yes, we can do it without extraction, whereas the other, they will say no, I think it would be very difficult without extraction. And those cases are really difficult to take the decision. And then comes camouflage cases, where we know that the skeletal pattern is not in our favor, but we would like to help the patient because patient does not want surgery for one or the other reason, or surgery is contraindicated for one or the other reason, but we want patient to have a good, pleasing, acceptable aesthetics. First of all, let's see what are the indications. And as I told you in one of my lectures, that whenever there is an indication to extract, there is an equal contraindication also exists. So first of all, we have to see tooth size, jaw size discrepancy. The available space is not adequate, and we have to align the teeth. First of all, we have to ask a question. Can we have another solution? Maybe expansion is a better solution. First of all, it's not that always expand. It's again, you are not going to put expanders in every single case coming in your way where you find some malaligned teeth and you put an expander and you start expansion of the arches. That is again not correct. We have to see so many things. Retraction of proclined labial segment, is it really required or not? If it is, what is the age of the patient? Can we utilize some other methods in order to compensate for that overjet? If patient is young, can we apply the jaw orthopedics using the myofunctional appliances or not? Or it is post-pubertal spurt time. If the teeth are carious, and which teeth are carious? Usually, first premolars, they are not carious as much as the first permanent molars are carious. Over here, we have to take a decision, because though the mesiodistal width of first permanent molars is larger as compared to the mesiodistal width of first premolars, but sacrificing first molars is not going to give us that kind of space as we can achieve, or they are not going to help us in alignment of the arches without a lot of struggle, as much we can easily align the arches after extraction of the first premolars. In order to, but then controversy comes. If the tooth is badly decayed, it is grossly carious, so instead of sacrificing a virgin first premolar, we need to sacrifice a carious first permanent molar. That makes more sense, because no matter you go for endodontic treatment and then you put the crown or whatever, still we are not sure about the lifespan of that endodontically treated tooth. So isn't it a better solution that we extract that tooth which we are not sure that it is not going to survive, instead of sacrificing? But for that purpose, again, we have to see what is the situation of the second molars. Third molars are coming in place, they are tilted, they are going to be impacted, mesially inclined, distally inclined, present or not present. Are we going to have good occlusal table or not? So many factors which we have to consider. The only problem, and the problems which we suffer actually in terms of orthodontic, because orthodontic treatment takes almost between somewhere 18 months to 24 months, and even at times it can be more than 24 months as well. And there, when as the situation changes, then certain thoughts, they start coming in. Oh, we have done this, we have done that, we should have done this, etc., etc. Take your good time in analyzing a case. Take your good time in planning a case. Instead, that patient comes to you and within like 5-7 minutes, you decided, okay, it's a class 2 day 1 case. I'm going to extract the first premolars and I'm going to put the braces. That is not the solution. Analyze. Or if it's like Okay, I can see all malaligned teeth, class 1 malocclusion. I'm going to extract all the premolars and I will align the arches and it will be good. But what is going to happen to their lips? What if they are going to have a dished type of facial profile later? So you have to take the decision after proper analysis. Well, camouflage treatment. We have to first of all see, is it the only solution left, or we can convince the patient to go for some better solution as well. This debate to extract or not to extract, it has a very long history. Edward Engel, who was the father of modern orthodontics, he was never in the favor of extraction. According to him, nature has created all the teeth to be present in the arch and we have to keep the teeth in the arch. Tweed, he actually rebelled or he revolted from his thoughts and he gave the idea of extractions. But again, we have to see certain things. First of all, expansion. Can we expand it to accommodate all the teeth, or there is some limitation? Advantages of extraction of some teeth to provide space, yes, that would be, but after aligning the facial aesthetics, are they going to be good or they are going to be compromised? With extraction, the loss of a tooth or teeth is a big disadvantage. And once a tooth is out, it is out. So before deciding, think a lot. Yes, greater stability and supporting tissue health are likely, and it is a big advantage. You have to weigh advantages over disadvantage. Well, as I have already mentioned about the effects on the facial, which we are going to discuss now, positive or negative effects on facial aesthetics about the extraction versus expansion. Every single patient is a different individual. If we keep this thing in our mind, and we should take our good time in analyzing one case before taking any decision, our final product is going to be best. Discuss the pros and cons with the patient as well as with the parent before making the expansion or extraction decision. Whatever you have to do, decide what you are going to decide. Always discuss it with the patient and parent, and whatever you are going to do, it should be done with the informed consent. Crowding cases. In these situations, facial and dental aesthetics, post-treatment stability, and dental occlusion are the key factors to decide, are you going to expand the arches? Are you going to accommodate the teeth in the available space? Or you have to extract the teeth so that they will be properly aligned, and in future, it is going to be a stable situation. Well, aesthetic considerations are also very important. Expansion of the dental arches tends to make the teeth more prominent, whereas extraction make them less prominent. We have to keep this key factor in our mind before deciding. Do we need flat lips or we need full lips? Well, depending upon the situation, any of these is going to be acceptable. And then comes stability, which I'm going to discuss in a while. The choice between extraction and non-extraction, which is an expansion case, it is a critical aesthetic decision for some patients who are towards the extremes of incisor protrusion or extreme of retrusion initially, in the beginning. But because there is an acceptable range of protrusion, means like some of the protrusion is acceptable, aesthetically it is okay, it is not going to impair the aesthetics. So most of the cases without extractions can be treated. Then comes the stability question. Extraction is going to be more stable, whereas non-extraction cases are going to be less stable. Like extraction cases are going to give us flat lips, whereas non-extraction, they are going to give us full lips. Here, full lips, but stability is not promised. Whereas extraction is going to give us a, we are not saying that it is going to give us a promise. It is not going to promise that it's going to be a stable case, because relapses are always there and mismanaged cases, they are not going to be stable. But usually it is thought that extraction is going to give us better stability. Flat lips could be a very big question. So both the factors of aesthetics and stability we have to consider before taking a decision. Expansion tends to make arches less stable and extraction favors stability. That is a general rule. The extraction and non-extraction decision probably is a critical factor in stability, largely for patients who are towards the extreme of the protrusion or retrusion distribution. Same as having flat lips or more protruded lips. Studies suggest moving lower incisors forward more than 2 millimeter will be a big problem for stability. Because if you are going to procline the lower incisors more than 2 millimeter, then lip pressure would be there, which will make the case to relapse by any means. A considerable body of data shows that expansion across the canines is not stable at all. If you are going to increase the intercanine width, that is not going to be stable at all. No matter you have retracted the canine or whatever, expansion in canine area, that is not going to be stable. Yes, expansion across the premolars and molars, it is stable if it is not overdone. Means you are keeping yourself within the limits. Here we can see that if you are going to procline the incisors, only 2 millimeters would be okay. Yes, premolars and molars you can expand, but it should be within the limit. Canines, it is not going to be stable at all. Another problem with the proclination of the lower incisors, as I have already mentioned about the lip pressure, you are going to procline more than 2 millimeter, it will be too much of the lip pressure, which will tend to relapse the case. Second thing, soft tissue problems. Chances of gingival stripping, because gingivae in the lower incisor, it is very fragile and very less amount of the attached gingivae would be there. So chances of gingival strip, as well as there would be chances of alveolar bone fenestration when there will be proclination of the lower incisors. In that case, always consider a periodontist, a seasoned periodontist who will tell you, okay, you do it, later we can manage it by some mucogingival procedures. When we say about the extractions in crowding cases, certain things we have to keep in our mind. Less than 4 millimeter of arch length discrepancy, if it is present there, extraction is rarely indicated. We extract only if there is severe incisor protrusion, or in a few case instances, if there is severe vertical discrepancy, means the lower face height is having discrepancy. It can be managed without arch expansion as well. I'm talking about less than 4 millimeter of arch length discrepancy. You can go for interincisal stripping and alignment, so things could be easily managed. Arch length discrepancy between 5 to 9 millimeter in the arch, non-extraction or extraction treatment, both are possible. Here, our clinical experience, here what we want to achieve, that dictates. No case is a good case, no case is a bad case for extraction or for expansion. The decision depends on both the hard and soft tissue characteristics of the patient and on how the final position of the incisors will be controlled. Any of several different teeth could be chosen for extraction, depending upon the situation. First premolars or first molars, depending upon the situation. Arch length discrepancy of 10 millimeter or more, extraction almost always required. For these patients, the amount of crowding virtually equals the amount of tooth mass being removed, and here better solution is extraction of the premolars if otherwise not contraindicated. First premolars. Proclination cases with crowding. Protrusion, in addition to crowding, it is going to complicate the extraction decision. Once we are planning to retract the incisors to reduce the lip prominence, it requires further space within the dental arch. So there is a simple rule when we are planning for the retraction. 1 millimeter additional space on either side of the arch will be required for 1 millimeter retraction of it. You are retracting 1 millimeter, but 2 millimeter space will be required in the arch, 1 millimeter on each side. Keep this thing in your mind. If there is 6 millimeter of crowding in both the arches and there is a normal overjet, 3 millimeter to correct lip protrusion and incompetence, 12 millimeter of the space in the dental arch would be required for that case. Lips move about 2/3 of the distance that the incisors are retracted. If you are retracting 3 millimeter of the incisors, the lip protrusion is going to be corrected by 2 millimeter. This slide number 13, very clear cut. It is going to give you what you have to do in case what you are planning to achieve. Final guidelines for decision making. The more you can expand without moving the incisors forward, the more patients you can treat satisfactorily from the perspective of both aesthetics and stability without extraction. The more you can close the extraction spaces without over-retracting the incisors, the more patients you can treat satisfactorily. So you have to decide between the two from what you can achieve. From the perspective of both aesthetics and stability. Again, both of them. Excessive expansion increases the risk of mucogingival problems. I have already mentioned it. And you have to consult all the time with the periodontist whether in future they can correct the problems which may be created. In considering the function, no matter you are going for expansion or for extraction, difference is not going to be there. Here, more about stability as well as about the aesthetics. For camouflage treatment, what it is, when facial disproportion disappear or at least reduce to the point that it is no longer a problem for the patient without changing the jaw proportions that underlie it, that is known as a camouflage treatment. The treatment outcomes depends upon the satisfaction of the patient as well as the practitioner. As we say, beauty lies in the eyes of beholders. So if patient says that, okay, now I am satisfied, I look acceptably, my appearance is acceptable, so it is okay. And of course, practitioner also be satisfied. Patient's choice prevails over here. It can be done by protection of lower incisors or by extraction and retraction of upper incisors. Borderline cases are always a problem. When extraction of teeth is required to reach a stable and functional occlusion, but patient has good facial aesthetics that could be disturbed by extractions, that is a borderline case. Decision taking is difficult in these situations. Patient, parent, preference, and operator's skills in diagnosing and treating a case, all these factors are really important once you have a borderline case. Because if you are going into the data available in the text available on different in different articles published, you will find equally that some of the cases they will claim that we have achieved satisfactory results with extraction. The others will say no, there was no need for the extraction. Just a minute. So here we have the last note. Any decision regarding the need for extraction of teeth during orthodontic therapy is not only dependent on the presence or absence of space in the dental arches. Other issues should be evaluated in order to achieve proper malocclusion, correction and maintenance or improvement of facial aesthetics and result stability. Other than only the space available or not available, soft tissues, soft tissues dictate you. And facial aesthetics, are they going to be impaired or they are going to be improved? And whether our treated case is going to be stable or not. We have to keep all these factors in our mind before planning, are we going to extract or not. So hopefully I have uh, fulfilled the purpose of this lecture, because so many queries, so many questions were there about the extraction and the orthodontics. Any further queries, any question, definitely we will come back to you with the solutions. You can always ask the questions and I will be here to answer those questions. Another thing, instead of having our these online sessions every week, this week it is just because of the Allama Iqbal's birthday we are having it. We can do it every 15 days so that more queries, more questions will come and we will choose those queries or questions. Or if there is another topic of choice, we can always go for that and we can address to that. So we will meet next time after 15 days instead of after 1 week. So any topic you want me to discuss, I am available for that. Over to
Thanks
Farooq.
a lot. Thanks a lot, sir, for today's great lecture. It was a very great, informative lecture. Again, very thank you for delivering this. Thank you,
Thank
sir.
you very much and
Khuda Hafiz.
Allah Hafiz.